BP, some patients need antihypertensions. This is the most common side effect. Some rashes, some GIT discomfort is all bit common.
But for how many cycles do we need to complete, or there is no such cycle?
Okay. So as long as patient responding, the tumor are shrinking, not evolving, we can continue. No, we still need to continue. If in the stage 4, yeah, forever.
Means 80,000?
Every year. So, yeah.
Oh, 80,000 per year or
per year?
Oh, per year. I thought per month.
Per year. Yeah. So as long the tumor is responding to the treatment, you need to continue to take that.
Use it as long as?
Yep. As long, we call it not disease progressed. So what do you mean disease progress? Let's say you have a tumor on the left side. After treatment, you already, from the 10 cm, it's become 4 cm. So that is a good response. Then you're taking, let's say, for 2-3 years. Suddenly you do CT scan. From 4 cm, it becomes 6 cm. Suddenly you saw another lesion in your brain. So it means disease progressed. So you have to change to chemotherapy, probably need to change for brain radiotherapy and all those things.
Yeah. Doctor, sorry. Just now you mentioned a few names of the medicine, right? Ending with tinate. Let's say, okay, nilotinate, imatinate. Is there tinate specific meaning?
No, it is because of the TKI. We call it thyrokinase inhibitors. So they put the same synonym. So the family called thyrokinase inhibitor, the synonym comes same. Yeah. Like we put bin and binti, right? So same like that.
So basically it's all kind of current immunotherapy drug or targeted therapy drug. They are different with chemotherapy where they only like for 6 cycles, 7 cycles, but for targeted therapy and immunotherapy they need to like
Lifelong.
as long as
Yes.
possible, like
Yes.
more
Yes.
lifelong.
Yes. So even chemotherapy is lifelong. It follows the schedules because you have an intensive schedule. Second is a maintenance schedule. So intensive schedule mostly give a combinations, maybe 2 chemotherapy or 3 chemotherapy. So when it's respond, we give a maintenance phase. Yeah. So maintenance phase actually makes sure the tumor don't grow.
Even the patient is remission, the report have say all tumors will solve.
Okay, then you only see if the patient comes in very early lung cancer. Very early lung cancer. Yeah. That's why we are advocating lung cancer screening. Let's say patient comes stage 1, stage 2, we'll go for operations. So they remove the lobe and then we just monitor with the CT scan. And of course, certain disease you must take some medication, some of the TKIs. Certain you not required, just monitor. So we say stage 1, in order for you to recover from the lung cancer is 93 to 95%. So it is stage 1. Stage 2 slightly lower, 85%. So it means if you diagnose very much earlier, for you to surviving not taking all this drug is 95 to 85%, which is a lot. So that's why lung screening is very important. Like how we do a medical health check, it's important.
For certain investment generic,
Rotanim, wait for the patency expire.
no,
Wait for patency to expire. Yeah.
For operation, you open up the chest.
No, we have a few methods. One is called video-assisted thoracoscopy. It means they just do the whole ear and just do the operation. No need to have a big, long cut like last time. It depends on the tumor size, depend on the location, and also depend on your anatomical position. If let's say we try to put camera, of course I don't do, cardiothoracic does. So when you put a camera, they can do, they do it. If you cannot, then only they do open up. Now everything become robotic already. Robotic and laparoscopic.
You have robotic operation here yet, right?
In Malaysia already have for the urology. HK already have the robotic. Yeah. For lung cancer, we still have a laparoscopic method.
Doctor, how, according to your experience, now I think there's a lot of breast
years in this treatment of lung cancer. How long the longest patient can last?
Okay.
Survive?
So, so this is a very common questions the patient asks us, isn't it? Once you come stage 4, stage 3. So what we tell is, of course, statistic is statistic, data is data, is a pool data. If you look at the statistics, if you are stage 4 lung cancer, without a treatment, you only survive for 6 months. 6 months. Without a stage 4, without a cancer. Chemotherapy give you additional 3 months, become 9 months to 10 months. If you take thyroid kinase inhibitor, that was like talking about gefitinib, it give you 1.5 years extra. Okay? But this is what data shows. But what we seen, some patients even survive more than 2 years and 3 years. Not everybody follow what's written in the statistic. So we will tell the patients is depend on the response towards the medication, alright, and we will progress accordingly. Many of our patients sometimes survive beyond what we expected. Some even survive more than 3-4 years, even for 5 years. So I have a lung cancer patients, they already advanced lung cancer, already brain tumor, already brain invasion, invaded to the heart, blood clot in the heart. I seen her since 2018. She survived until now. So how we actually can say, so it depends on the individual as well. So she when the presentation, she already have an advanced cancer. So I just saw her like 2 months ago. Of course, it's come together with the patient's willingness to take treatment, family support, and to follow the schedule. Yeah. If you don't follow the schedule, you don't take treatment, of course your overall survival will be poor.
It is true that for breast cancer, if there is any metastasis, they always go to the lung. Because it's the nearest organ to breast.
Okay, so yeah, you are right. We always say lung is a very favorite organ in all human body. You can go anywhere, any cancer, any infection can go to the lung. So that's why we always tell in all our students, we say, you need a lung to scold your wife, you need a lung to scold your friend, you need a lung to scold anybody. Okay? Kidney failure patient can scold, isn't it? So that's why lung is most important. You do spread to any lung also can spread to any cancer also can spread to the lung. So not only the breast cancer. Yeah.
Excuse me, doctor. I have CML for 16 years.
Sorry, what do you have?
16 years.
What do you have?
Yeah, CML.
Okay.
Okay. So every 6 months I will have this PCR and blood, right? And then status is undetectable. So I thought I can have remission. I don't want to take medicine anymore. But the doctor told me that I still have to continue just in case suddenly I have a kid CML. So I think, why is that? Can I get a remission?
I'm not a hematologist. Yeah, I'm not a hematologist, but technically once you have a chronic myeloid dysplasia, and what we know is because it's already in the body, so giving the medication to harbor all the cancer cells, it means make the other cells become dormant, not active. Alright? So you need to have a surveillance. So when actually it active, nobody knows when it become active. It's number one. Number two, of course you need some medication to suppress. It's like how we say you need a police to make sure there's no bandit, right? Not necessarily you already have a police, we cannot say no bandit at all, isn't it? Can we say we have a PDRM in Malaysia, no bandit, no thief, cannot, right? Because the police, a lot of bandit and thief are very quiet and silent. They want to do the activity also, they see the opportunity, isn't it? Same also, the cancer cell. So the cancer cell look for opportunity to flare up. So how we going to monitor? That's why policemen, you can see every night they do surveillance, right? Ronda, right? Ronda, Kota Raya, right? It's the same. The cancer cell is the same. So cancer cell is like a thief and bandit in your country. So you need a police. Who's the police? The treatment is the police. Yeah.
Okay. Thank you, Dr. Vijayan. Thank you, ladies and gentlemen, for all of your questions. We will be moving on to the next session